You have to do it for yourself, you have to do it for your family, you have to do it.
And now that my migraines can be fixed.
You got your life back because migraines can take it away.
It's just amazing that a little stimulation could take away that pain.
Everybody's looking for that miracle, and I'm convinced that I found it.
Only 1 in 4 U.S. households include someone who suffers migraines, chronic, severe, and sometimes debilitating headaches. But our next guest says he has a breakthrough treatment, and he's brought a patient with him who says it works. Dr. Kenneth Reed is the developer and inventor of 4-lead neurostimulation treatment and medical director for Ascendant Neuro. And Kim Rutherford is one of his patients. Good to see both of you.
Here's the little device that we implant under the skin, over the eyebrows. Kim has it in. When it's turned on, the patient feels just a very mild tingling sensation in their forehead and back of their head, and from certain mechanisms, it effectively stops the migraine from happening. It tends to be a pretty dramatic effect.
Well, new hope for the more than 20 million Americans suffering from those migraines and protection against 2 health concerns for children. Medical reporter Janet St. James is here with all the health news today. Janet.
Shelley, migraine pain for some people is unbearably painful. Well, some North Texas doctors are now trying surgery on patients who've been unable to find relief with traditional treatments. Dr. Ken Reed, a pain expert at Forest Park Medical Center, says it's like a pacemaker for headache nerves. The procedure takes less than 2 hours and is covered by some insurance companies.
Virtually just completely stops the headaches. We see 90 to 100% pain relief in the headaches.
It's amazing. It's life-changing.
After having the neurostimulation surgery last July, Kimberly Schoaf says her migraines are gone, and she has a new lease on life.
Migraines affect millions of people, an estimated 11% of the population.
There is no cure, but a new medical procedure is promising relief for people who suffer the debilitating headaches on a daily basis. New at 10, NBC5's Susie Solis looks at a treatment that puts patients back in control.
15-year-old Jessica Andre has spent much of her teen years visiting with doctors.
It starts in the back, like the beginning of my neck, and it just goes up.
A constant migraine for the past 2 years has affected her life dramatically.
A lot of times I just want to lay in bed all day. I've tried a countless amount of medicines, none of them worked. I've had Botox injections, an occipital nerve block. I've been to a massage therapist, been to a chiropractor, tried everything.
Now she's undergoing a fairly new procedure.
It's somewhat analogous to a pacemaker for the heart. A little battery is under the skin with little wires that pass under the skin, 2 of them over each eyebrow and 2 of them in the back.
Electrodes provide electrical stimulation to the nerves in the brain.
The patient perceives a very mild tingling sensation of vibration, and the net effect of it is their headache goes away in a dramatic fashion.
Patients first get a trial simulator for a week's time, and if it works, the patient will get a permanent implant. Doctors say the procedure has an 80 to 90% success rate. They'll put in the trial neurostimulator, and most patients will know within days or even hours if the procedure worked. For Jessica, there is good news.
I woke up and the back headache was totally gone.
Now she controls the migraine and not the other way around.
My migraine headache started approximately 33 years ago. Actually last month in May, and very intense pain. The pain was so bad it would make me pass out. I wasn't able to function as a normal person. I just wanted to be normal like everybody else, but it seemed like as each month, each year went by, we'd go to doctor, medication after medication, treatment after treatment, and nothing changed. And I just became sicker and sicker, and it just became my life.
Yeah, a lot of time it took a combination of things just to survive. We would do medications, we would do special diets, we would do a chiropractor. We would have 3 different doctors, and we'd be doing something with all of them at the same time, just trying to make it.
I have tried every migraine medication that you can even think of. For 6 weeks, did great. And then my system just rejected it, and it didn't do anything. Just the stress of going to another doctor, he's not going to find anything. is he going to find anything? How long is this going to last? Maybe it's going to last 3 months, and then they're going to give up on me, and I'm just going to get pain medicine from them. And from every doctor, you get pain medicine, even though they're going to give you maybe something that's going to deter the headache or something when you feel the onset of a headache. You always have in your back pocket the pain medicine. And I always took what they told me to take, which did absolutely nothing. So what's the next best thing? Is, oh, I'll double it up. And I could double it up, and it did absolutely nothing to me. The day we had to go see him, I had one of my worst blown out headaches, and we were in a waiting room full of other patients. I actually didn't see anybody hurting because I was so enthralled with my pain. Finally, we were called back there into the room, and I just got up on the bed, and I'm on all fours with my head into the table. And anything you can do to push on a hard surface to relieve the pain. It's almost like you need a vice to hold your head. And Dr. Reed walked in the room, and he said, "Mrs. Doherty?" And I said, "Yes, sir." And I don't even recall looking up at him. And he saw the pain I was in. Didn't ask my history. Didn't ask what doctors I've been to. Didn't ask what medications. He just looked at me. He said, "Mrs. Doherty, I'm going to help you." And it was just like, this is my miracle I've been waiting for.
My name is Dr. Ken Reed. I practice here in Dallas, Texas with my partner, Dr. Kelly Will. Various hospitals here, primarily Presbyterian Hospital, Texas Institute of Surgery, Forest Park Medical Center. We've been in practice for 20 years in Dallas, and for most of that time have been involved with the treatment of headaches, particularly with neurostimulators here. We implanted the first neurostimulator actually done in the world for headache control in 1992, and we extended that technique more generally to headaches about 4 years ago when we started applying it to severe migraine headaches. Over the years, I've implanted hundreds of neurostimulator leads and full neurostimular implants for the various types of headaches. I don't believe that there's any place else in the world that has the experience that we have here. Neurostimulation has been in use for a long period of time, a very standard, well-accepted treatment. It involves a very small or relatively small little battery under the skin. To repeat, you really can't see anything. It doesn't limit you. The patient can't even feel that it's there. But what it is doing in a very safe fashion is stopping their headaches. The process of putting in a implanted stimulator is really a two-step process. The first step is a test or a trial stimulator to see if it works. The things to emphasize about the trial is that it is very simple. While we take all medical procedures very seriously, including this, it's hard to get much simpler than a tiny little IV tube coming under the skin. So the thing that we look at with any treatment is the pro and con. What good can a treatment do versus what's the downside? Well, the upside of this, of a temporary stimulator, is very clear. The pro is if it works, the patient will be very happy. Their headaches have finally been taken care of. What's the downside? Physical downside, none, minimal. This cannot make headaches worse. It can't hurt the nerves. There's just no physical downside. The only downside to this, if it didn't work, if they were in the 20% of patients it didn't work, well, they're disappointed. But again, no other downside. So circle back once again, the beauty of the stimulator is this ability to test it with a very simple, safe, painless test that lets them know for sure whether the permanent unit's going to work.
I, was completely limited. I couldn't do anything. Stuck at home, dark bedroom, cold room, the typical, I've got a migraine, don't talk to me, irritability, everything.
We've been using stimulators for chronic back pain for 30 years or so. And Dr. Reed decided one day somebody with headaches to try putting a stimulator over the peripheral nerves that supply around that scalp. And the patient had really good relief, and that's how it all kind of got started. Now to have a procedure that gives people either complete relief or 80–90% relief, that was real dramatic, and that was, just the stories you get back from patients was what makes it worthwhile.
I can do anything. I feel like I can experience anything. My pain isn't holding me back. I'm, going to school, experiencing life to the fullest as where I wasn't before. The neurostimulator completely gave me my life back. My life has completely changed. I've done a 180, and I feel that I can experience anything because I'm pain-free.
The people that are candidates for this are patients with severe headaches that have been through other courses of treatment and they're just not responding, or they're not responding that well to high doses of medications. We treat a lot of different diagnostic categories, and I want to emphasize that patients shouldn't worry so much about whether their diagnosis works or not. They all do. In particular, what we're looking for here are patients with severe headaches, whether it's severe tension, migraine, whatever. This can work on them also. It's the severity. The type of pain that we're talking about here typically are patients that have frequent headaches, number one. By frequent, at least several times a week, and most often daily pain. And within that group, most often almost continuous pain. The severity of the pain is typically pain that will actually put them to bed. They cannot go to work. They're going to bed with it. They can't go to school. Oftentimes it's bad enough they're going to the emergency room for treatment. Certain types of headaches are described like a knife going in through the eye. And it'll escalate, and then it involves other symptoms, very commonly nausea and vomiting with it. A lot of people, either during or more commonly before a headache, will get what we call an aura. They may feel a certain way. They may have a certain weird smell. Often they'll see little flashing lights in front of their eyes, which heralds a headache coming on. These are all very real physiologic phenomena that's going on in the brain itself. So again, we're talking about kind of a constellation of symptoms and a spectrum, but generally very severe, frequently cannot participate in normal activities, frequently to the emergency room. Universally, they have to go to bed, and it's to the point that the medications are not working. While we feel it's very safe and a relatively simple procedure, nonetheless, it's still an interventional procedure. It's an implanted unit. So with that, if patients' headaches respond to more conservative traditional treatments such as medications, then there would not be no reason to consider this.
We're bringing you the latest ways to end migraines, banish blemishes, and live longer by catching problems early on. Next up, migraines. Rachel is desperate for help.
Hi, doctors. For the past 2 years, I've had horrible migraines. My head hurts 24 hours a day, nonstop, and it feels like my brain is exploding inside my head. I can't go anywhere with my friends because bright lights and loud noises make it so much worse. I've tried all kinds of medications, but nothing seems to help. Please help me.
It's been just a few days since Rachel's surgery. She's still recovering. That's why she's joining us via Polycom from her home in Tulsa, Oklahoma. We also have Rachel's physician, Dr. Kenneth Reed, along with us. He pioneered this new neurostim migraine procedure. So thank you both. Rachel, how are you feeling?
I'm feeling pretty sore. It's been a few days since my surgery, but my headache is basically gone. It's amazing.
Well, we are certainly happy to see you smiling. And Dr. Reed, this is a unique treatment for migraine sufferers. It's obviously not for everyone, but tell us about it.
Right, exactly so. It's not for everybody. Most people don't need it. It's for people that have very, very severe migraine headaches, frequent, several times a week, that are not responding to other more conservative treatments.
And it's interesting because people do not fully realize that some migraine sufferers, their main symptom is a headache. But for other people, I've had people come to the ER, they're blind. They can't move half their body, and you're sitting here thinking, are they having a stroke? And of course, you have to rule out all these other things. But the fact that some people who suffer from migraines have these just so severe debilitating symptoms, this is something that they could potentially do to help. And I love that as an option.
And it's highly gratifying to see people like Rachel. They get their life back.
Dr. Reed, thank you so much for joining us today. We really appreciate it.
Yeah, thank you very much for having us here.
And Rachel, it's great to see you. smiling on TV for us today. Stay well. Thank you so much.
The mechanism by which neurostimulators work is that the battery generates a very mild electromagnetic field at the tip of a long wire. Again, there's a small battery, and we have to conceptualize a very long, thin little wire coming out. And at the tip is a really mild electromagnetic field. The little wire is right under the skin in the forehead and back of the head. Again, you can't see anything. The electromagnetic field basically stimulates the very superficial nerves in the head, and the patient feels a little tingling sensation or mild vibration, which they describe as feeling very good. It's a very soothing sensation. And by certain mechanisms, that effectively stops the headache pain. There's medical studies to show that even though it's stimulating the superficial nerves, those are in turn stimulating deep centers in the brain, the deep nuclei, felt to be related to the areas that are important in the genesis and modulation of headaches. The perception is just a mild tingling sensation, but the way it works with the deeper centers in the brain is in a very safe fashion to really just stop or prevent the headaches from occurring in the first place. It works extremely well. Physicians are always cautious to overstate what any kind of treatment can do. So I'm discussing this with that fully in mind. This is not a treatment that a patient would have where they were some better, a little better, which is very common with other treatments. Maybe the headaches are somewhat decreased in frequency, not as severe. Not the case here. For patients that respond to this, and we put in what we term a permanent unit, the response is, I term dramatic, night and day. With a test stimulator, we actually implant a temporary unit, which is no more involved than a little, what looks like an IV tube under the skin. Leave it in for 3 days, and the patient sees if it stops the headaches. And if it does so very dramatically, very quickly, and then we see them back 4 days later, and they'll tell us whether or not it worked. The way it's done is it's a medical procedure performed in the outpatient setting at the hospital. It literally takes about 15 minutes to do. It's completely painless because the patient has an IV sedative. Once the patient's asleep with the sedative, it looks like we put a tiny IV tube above each eyebrow and then 2 in the back here. Important to note, just like an IV, it's no further under the skin than this. In other words, nowhere close to anything that could be damaged. There's no incision. The patient goes to sleep for 15 minutes. When they wake up, they look a little funny. They have some tape here and long little tubes out. To repeat, very akin to an IV tube. Well, these little tubes plug into a little battery box that's on the outside of the body. Immediately when they wake up in the recovery room, there's a rep from the company there that will turn the unit on, and what the patient will feel is this very mild little tingling sensation in the forehead and the back of the head. Commonly, we might do this on a Friday morning. The patient will go home over the weekend, and then 3 days later come back to my office where we remove the temporary unit. When we remove it, you basically take the tape off and the little IV tube just slides out. It doesn't even need a Band-Aid on it. And at that point, again, they'll tell me whether or not it worked. If it did not work, then quite simply they're not a candidate for the permanent unit. If it did work, and in most cases it does, and again work in this very dramatic way where it stopped their headaches, then we set up and plan a permanent stimulator implant for a couple of weeks later. One of the beauties of an implanted stimulator is this ability to test it before we actually do the full implant, and the test is very convincing, it's very persuasive. So that with a high degree of confidence, we know that when we implant the permanent stimulator, that it is going to work, and we know how well it's going to work because of the test unit.
Imagine having throbbing, debilitating migraine headaches every day for 3 years straight. And to make matters worse, you're 15 years old. Well, this was Emily's unfortunate reality that she shared with us last season. Let's have a reminder.
About the middle of 5th grade is when Emily started getting migraines.
Just throbs. I can't concentrate with it.
Earlier this year, we discovered the Reed procedure. We actually saw Dr. Reed on the doctors who invented the procedure. she went down for the trial, we were very happily surprised when she had no head pain.
I felt really happy that they were just gone.
We immediately applied for the permanent procedure.
Did it work? We'll check in with Emily when we return. We're with Emily and Dr. Kenneth Reed, who invented the procedure that you just saw. And the question is, Emily, how long has it been since the procedure?
Almost a year now.
And how are you doing?
I'm doing great. It's fantastic.
And as far as a year ago, after this procedure, Dr. Reed, how long until they start feeling better in general?
In terms of recovery, within a day or so, people can travel back at work or at school within a week. And 6 weeks later, no restrictions. I mean, literally contact sports. We have baseball players, gymnasts. So it's a serious procedure, relatively minor, and the recovery's straightforward.
For this particular procedure, who would be the best candidate?
So the two criteria are frequent severe migraines, 2 or more a week, and that more standard therapy is not effective. You're basically living with severe migraines.
Well, Sarah and Rodney as parents, what's her change been like?
It's amazing. I mean, we have our daughter back. I mean, she's...
Is it even hard to think back to how much she went through?
Yeah, it is. But I mean, she's able to swim. We go to the gym together. We go to the grocery store. We go eat at restaurants. She wears perfume. She eats chocolate. We went on vacation. We just celebrated her sweet 16.
Congratulations.
Wow. I mean, those things sound maybe to some people like they're not, so important, or they're trivial, or maybe not worth this type of really invasive procedure. But let's be clear, that speaks to your quality of life.
Oh,
and you are so young, this literally is life-changing. I'm so happy for you.
And the takeaway here, we've said it many times before, anyone suffering with migraine headaches, if you're not getting the relief that you feel like you need, obviously, look into other options, look into other possibilities. We're just so happy you found the right one for you, Emily. Dr. Reed, thank you so much.
You're welcome. Thank you.
First is our website. There's a lot of information on the website, and we have links to other websites and other information on it. Part of the website I think people would find interesting are the testimonials, particularly the video testimonials of patients that we've implanted stimulators in. In terms of patients getting information or further information about this procedure, maybe the best is what we term the Patient Ambassador Program. It's always, I think, valuable for a potential patient to actually speak to another patient. It's one thing hearing the doctor talk about the procedure, and we try to be very straightforward with the patients, provide the information, but it's another thing to actually sit down and talk to a patient that has this implanted. Most and possibly all of these patients that we implant are very happy as I just mentioned, to meet the patients, talk to them on the telephone. All the patients are always telling me, look, Dr. Reed, have them call me. I'll be happy to talk to them, explain to them what it's like to have this in. So clearly they're the best spokespeople that we have for the procedure, and we encourage any potential candidates or patients for the procedure, to look into this.
A definite high was when we realized the trial really was going to work, and we could believe, yeah, this really is it. And I don't mean to seem like it's the miracle cure and it just makes you not a migraine patient any longer, but it is absolutely life-changing. And every minute of our lives has been different ever since then.
As a parent, I would say don't go through everything we had to go through before you get to this, because I would highly recommend it. Changed my life completely.
I've got my life back.
I got my soulmate back.
I'm just so blessed to be able to have had the procedure, to have insurance cover the procedure, to have met Dr. Reed, and have him listen to me and know exactly what I need, and for him to be doing this on people. I'm sure he's changing a lot more lives than just mine.
On June 5th, 2009, I went in and had the 4-lead neurostimulator implant. It was the best day of my life, and in fact, it was the day I got my life back.
After the final procedure, I was back coaching gymnastics. I was back doing flips off walls, jumping on the trampoline, doing flips on that, playing slam ball out in my backyard, which is, we lower the basketball goal to 8.5 feet, and it's really physical. There's no fouls called, and it's a really rough game, so I've been able to do everything since. I hadn't had not a headache in 9 years. I didn't even remember what it felt like, and it felt terrific. The stimulator just feels like someone's massaging my head, and my head hasn't felt this great since I can remember. Dr. Reed has done a miracle.